Alright, so this is my first video, and this is going to be on section B of the shoulder. So we're going to start off with active range of motion of abduction. So first, you're going to want your patient to be supine, and then next I'm going to have him demonstrate this motion for himself. So I'm going to have him bring his arm and try to touch his ear. Alright, good. And then I'll have you bring it back down. And so now we're going to measure this, and when you're doing active range of motion, you always want to make sure that you measure bilaterally. And so for active range of motion, you put the fulcrum right on the anterior portion of the acromion process. You want the stationary arm to be parallel to the sternum, and the movement arm is going to line up right up with that humerus. So I'll stand on this side so you can see. And so now I'm just going to follow his movement, so I'll have you abduct again. And so the number for him right now is about 175, which is good because for this, for abduction, you want it to be about 170 to 180 is about the normal range. And so next, we'll do internal rotation, and for that one, you're going to want to use a bolster or a towel of some kind to try to make this, to try to get the scapula and the shoulder in line. And so I'll have him in this nice 90-90 flex position. And so I'll have him demonstrate it first. Try to touch your hand to the table. Just go forward as much as you can. Right there. Yeah. Alright. And then we're going to measure it next. So fulcrum on the left arm process, stationary arm perpendicular to the floor. Move an arm right in line with the ulna. So I'll have him move his hand down. Go. We'll just follow that right along, right about there. And so you can relax now. And so his number is at 84, which is good because the normal range for internal rotation is going to be about 80 to 90 degrees. And so next we'll move on to passive range of motion. And so for that one we're going to be doing external rotation. So we'll just stabilize right here at the humerus, grasp the distal forearm, and just go back as far as you can. Alright? And so for this, you should feel a firm end feel due to the tightening of the joint capsule, and then the glenohumeral ligaments and the coracohumeral ligaments should be all stopping that. And then next, we'll move into manual muscle testing. We'll do flexion first, so I'll have you with your arms at your side. And then I'll have you lift this one at about 30 degrees flexion, so we're right there. Stabilize the shoulder. I'm going to press down against your forearm, and I'm going to have you push back up against me. Alright, that's good. I would call that about a 5 out of 5. And so the muscles being tested for flexion are going to be your anterior deltoid, your coracobrachialis, and your biceps brachii. And so next I'll have you flip over onto your stomach. And we'll do extension. So same thing, arms at the sides, stabilize shoulder. Probably bring this up at about 15 degrees since you're not going to be able to move as much in extension. And I'll press down against the forearm, he'll press up against me. Give that a 5 out of 5. And the muscles being tested for this one are going to be triceps brachii, latissimus dorsi, the teres major, and the posterior deltoid. And so these two could be done seated, but with that you'll have an extra step of trying to stabilize the scapula, so it's a little easier if they're laying down, so you don't have to worry about that as much. And so next we'll do the last test for this video, which is going to be the compression test. And so for that one I'll have him sit with his legs off the table. And then for that one, you're going to want to stabilize the shoulder, support at the elbow, and then you're just going to horizontally abduct. And so for this one, what you're testing for is the positive is going to be pain with the overpressure at the elbow. And then implications for this could be damage to the AC ligaments, or possibly there could be damage to the corticoclavicular ligaments as well. And that's it.